Are you looking for an internet talk radio station for your podcast? Look no further. At the helm of Passionate World Talk Radio are two women that want to provide a spot for you and your podcast to be heard. There are many other places for your podcast, but PWTR has the audience. You will not be disappointed. Our station has been on the internet for the past 16 years. Call us for more information. 484-364-1032 or text Jeannie White, station manager at PHECONNECTSHOW@gmail.com for podcast show details. Welcome to Passionate World Talk Radio. Educate, enlighten, entertain.
Hello, everybody. This is Betsy Wurzel, your host of Chatting with Betsy on Passionate World Talk Radio Network, where our mantra is to educate, enlighten, and entertain. The views of the guests may not represent those of the host or the station. Folks, you're going to want to listen to this podcast. I have a wonderful guest with me today who I wish I could clone. And I wish I could clone her for homes that she has, because they are such a role model of what should be done and how people should be cared for in their older years. My guest today is Maria Khader, also known as a Dementia Whisperer. She is a director. She is an RN. She is a certified dementia provider. She's also a certified Alzheimer's disease care trainer. She runs 4 homes called the JK House of Grace, and I highly suggest you check out that page on Facebook and see the work that Maria and her staff provides. It's incredible. If I lived in Maryland, I would have had my husband in that home if he needed to be there. I would have trusted Maria and her staff to care for my husband, and that's saying a lot. Welcome, Maria Khader, to Chatting with Betsy.
Thank you so much, Betsy, and good afternoon, everybody, or good morning to whoever is daytime at their country or nighttime at their country. I appreciate being with Betsy, chatting with Betsy on this radio show, and I'm always honored to talk and spread the awareness on the Alzheimer's disease and all what is doing to our people, our loved ones.
Yes. Oh, I might have forgotten to say you're a registered nurse. All these things in front of me. Might have forgotten to say that.
I think you did.
Okay.
Yeah.
Excuse me.
So today, Betsy, we will be talking about subject that most people they don't want to talk about it, or they're a little bit hesitant to talk about it. And I felt, over the years that I've been working with dementia, Alzheimer residents, patients, and what I see of their behavior changes, the intimacy and aging. I felt this is a very important thing to talk about and to spread awareness on the intimacy and aging, especially when it comes to dementia patients.
Yes, it's a very important subject to talk about. I just want to tell the audience, if you have any young children around, you might want them to go into another room, as this is an adult subject.
Actually, it doesn't. We will not talk about it's not really more open, it's offensive or offending anyone. It's just more education and more to tell people, like the caregiver at home, if her spouse or his spouse start acting, what to do, and if you are working in a facility like ours, this teaching actually, or this presentation is to help the caregivers, the frontline caregivers, whether it's a wife, whether it's a CNA, home health aide, caregiver at a facility, or private duty caregiver, what to do if she sees a behavior that has to do with sexuality in front of her by the one that she's taking care of. What to do, how to act to prevent other, consequences there. So
that's a good subject.
That's what I thought. I mean, I did this presentation yesterday at one of the assisted living in the area here, and when they listened to me, unfortunately, the audience that they were with me, they were the aging people themselves. So, it was a little bit harder for them at the beginning, and then I got them to be involved. And it came from them to say, one of them came to me and she said, can you please teach this to our caretakers? Because I am in relationship with someone, and each time they see me with him, they started to act different, and they are kind of abusing her. And I said, let's see that. It's okay. We're going to talk about it, and we're going to invite the caretakers. We're going to invite nurses. We're going to invite professionals, and we will start talking about it.
It's a very important subject, Maria. I think back to my dad. My dad was in a nursing home, and he had dementia. Now, my father was very outspoken before dementia, and he would say off-color things, regarding sex. And he was getting his diaper changed one day, and he said to one of the his caregivers, it was a woman, while you're down there, why don't you play with my revolver? Well, that was my dad, okay? That is my dad. I told the social worker, that's my dad being my dad, but take away the filters. So they medicated him for that. They gave him medication for that.
Yeah,
and
but this is exactly, we don't want to reach that point, We don't want to do medication to stop a normal need, and a physical need of a person. But we can deal with it in a more educated way and more objective way that he will not get harmed. The person in front of him taking care of him will not get harmed and will not get offended. And the problem will be solved without any other issues.
Right. Because I don't think he should have been medicated.
Exactly.
Right. Yeah.
Go ahead.
There wasn't the education then, Maria. It was, my dad died probably 12 years ago, so they didn't have that.
So
thank God for people like you.
Yeah.
Go ahead.
You're right. You're right. So when we say, we are going to do a positive perception, benefits of, sexual expressions, it can help them provide attention release. They don't have to be stressful about it. It's the stress reduction there. They will be it will give them a sense of belonging. It will lead to a positive relationship. It will be mutually pleasurable when you allow them to talk about it. It will enhance the self-esteem and the quality of life. That's if we are looking at making those people that they're aged, they're having dementia, they're expressing. The more they express about their needs, the more they feel less stressful. The more will reduce the tension, and the more will give them a good quality of life. But the dilemma here is what you just said. It's the lack of training. It's the lack of education. We didn't have it. So the frontline staff, nurses aid, caretakers, activity providers, nurses, whoever, these are the front line. They are the ones to report receiving the little or no training in their long-term facilities and the communities there about the sexual expression in the elderly. That means facilities are leaving it up to the staff to respond, react based on their own comfort level with the intimacy and sexuality. And why do we need to do that? We don't need to let them act based on what they believe. It should be act what they are trained of to do. So that's where we have to do more training about it. Am I right?
And right. And what kind of training do you provide, Maria?
Well, the training has to be by letting them know like they need to know the changes in the attitude of like towards the people that expressing sexuality. So because the more they allow them to express, it will lead to a very positive interaction between the caretaker and the residents or the patient. It will lead to less abuse from, if I want to leave it to the caretaker, some of the caretakers will not take it. You know, as you just said about your dad, they might just like, if this patient touched them inappropriately, they might slap him, they might push him, they might, like they think that he's harassing them, right?
Right.
So what happens is this will lead to abuse, and we don't want them to lead to abuse, or it might lead to a reaction from the patient himself toward his caretaker by either hitting her, by pushing her. You know, it can be both ways, and we don't want that to happen. So if that caretaker was able to respond in a positive manner, well trained how to respond to him, she will not reach the point that she will abuse him or he will abuse her. She might, you know, there are other ways of telling this person by redirect him, by discussing this with her supervisor and talk to him in a firm voice that, you know, Mr., you know, setting boundaries. You know, sir, I am here, your caregiver. You know what I mean? The voice changed now. She's not giving him a voice of invitation.
Right.
So, yeah. So there are, like, you know, the attitude barriers towards sex among elderly. You know, these are, if we educate about them, that will help the caretaker and the nurses, the caregivers, the CNAs, whoever is working with those elderly, is the stigma of the old age. You know, usually they would say, you know, sex is not for old people. Sex is only for younger people. And actually, if older people do sex, that's disgusting, or they should not be interested in sex. But our teaching will always say, no, older people, they will continue have the feeling, they continue have the urge, they continue have those even when they are older.
Yes, because everybody wants that human connection and human touch.
And the belongings, exactly.
Yes.
The double standard now. Someone would say, as, you know, a double standard here, elderly men are dignified. Elderly women are turned off. See, that's a double standard there. And that can become an attitude barrier towards sex among elderly. Religious beliefs. Some of them, they will say, you know, sex is only for reproduction. See, that's how they know about sex. That's it. Then they will say other children, they resist. They would say they couldn't possibly still be doing it. That's the son or the daughter of the older man or older woman. That, you know, it can't be. You know, they're old. Or the stereotypic roles that a real man has. That's only real men who can have the erection there. So these are kind of subjects that, or attitudes that we as professionals, we as people, we as children of those elderly have it as a barrier for us. Like, you know, my dad is old, he cannot do it, so he should not be doing it. It's disgusting to talk about it.
Right, and it needs to be talked about. You know, sex and intimacy is part of life, and it's not, you know, taboo. We need to talk about it.
Yes, exactly. It's not a taboo, no.
Right. I have to say, Maria, as you know, my husband had Alzheimer's for 10 years. Matt wasn't aggressive, you know, in that way. And some men and women, they or partners, those who have dementia, want to know, well, how can you have intimacy? How can you have that human connection? They can no longer do the act. Well, you know what? There's hugging. Matt loved to hug. You can hug your loved one. You could hold hands. You could kiss. There's that deep connection that you just have. I can't even put into words, but Matt knew I loved him. even though he couldn't, do certain things anymore, because I showed him that I loved him in other ways.
Exactly.
And this is where education really needs to be, for the spouse or partner also when it comes to intimacy.
Of course, it is very important. But there are other conditions there, important considerations that we have to remember, that sometimes, with sexuality, the use of medication side effect can affect that. We are going to talk about what might affect the intimacy in older generation, or even sometimes in younger generation, but we're talking about intimacy and aging now. Some medication can have side effects there on them, and it will not help them having a normal relationship. If the person has a stroke or COPD or diabetes, arthritis, and other illnesses, and of course, if someone, if his partner or her partner is having a catheter, that doesn't help. If there is a prostate issue with a prostatectomy, if there is any dysfunction with their erection, erectile dysfunction, if there is any sexual abuse, or if there is dementia or lack of privacy in the residential care. And that's also happening in most facilities, because facilities are not set to have intimacy there in them. So these are some important considerations that we have to remember when an older person come and talk to you about, why am I not right, or why it's not working with me. You just consider that what medication are you on. Consider his medical history. Consider if he's having any issue with the prostate, if they have even, mostly in females, if they've been abused sexually in the past, that affects their life too. And, of course, if they have any dementia issues. Now, the other thing is the physical and psychological effects that must be considered if this person, his prostate is being removed, the removal of the prostate, or the, issues with the prostate, or if this person has an amputation of his limb, whether a leg or both. If he has an amputation, he won't be able. These are also psychological effects for those people, that they miss a limb or they have a prostate issue. With the female, she might have a uterus or ovarian issues that also affect the relationship between her and her spouse. And some of them, when they have the breast cancer and they remove the breast, or if they have colostomy or ileostomy. They were asking me what is colostomy and ileostomy. It's like when the person is not able to use. It's an opening in the abdomen, so they can feces goes through the abdomen, from the intestine to the abdomen on a pouch outside the abdomen, but it will not go through the normal way, like the rectum area. So this is the colostomy. And the ileostomy is for similar issue, but it's for the urine. Now, we have to talk about clinical examples of a case where arthritis is the diagnosis of this person, and the pain and mobility was the major issue. So that's a very good example about intimacy in aging that the lady had, or the gentleman. Mostly I see in the work that I do is the female, that they have osteoporosis, osteoarthritis, or their arthritis is causing severe pain that they cannot move. And that will also affect their intimacy time with their loved one, with their spouse.
Yes. Yes, that's definite. I love all the information you're giving, Maria, because it's so very important. Go on. I'm enjoying hearing you.
Thank you. I was expecting more questions there from you, but
it's very.
We'll keep going.
You know what? Well, I do, because people don't. You're right. With older people, when you're It's funny. When you're young, you don't picture your parents as having sex. Let's face it, we don't want that image in our minds, but they are, and people are sexually active later in years, especially now with, people are aging better and healthier. So we will have these issues. And if there's, a couple, like say there's a husband and wife or two partners that are in a home or, facility, do they allow them to have intimacy?
Well, that's the question that it was raised too. And I said, this is why we want to educate. We have to educate, because if we as an assisted living or a long-term facility in a nursing home, and there's a husband and wife, I think I will encourage actually to give them some privacy and allow them to have their intimacy time. I mean, listen, it's one life to live, and it's a husband and wife, and it's a normal relationship. All what they need is their privacy. Allow this to happen to them and let them have, enjoy it. I mean, I don't think, from what I saw, from my own experience, I don't think that they will have it, their sexual, like the sexual intercourse or the sexual relationship. It is not as when they were younger. It might be just cuddling. It might, it doesn't have to be intercourse. It can be cuddling. It can be just touching. It can be just like sleeping next to each other to feel the warmth of each other. It can be just by kissing, hugging. That's all. That's still sexuality, but they want to have it, and it's something that they need, and it's something they express the need for it. Why don't we do it? Why don't we allow it? I think it is important to allow this to happen, because it's the right.
Yes, and I have to ask you another question, Maria, because this does happen, as you know, in facilities when the residents become attracted to each other, but yet they're still married to their spouses, or maybe they have partners. How do you handle that? Like two residents who want to be hugging.
Exactly, as I just told you. Sometimes you will see them already doing it. What you going to do? I mean, you will see them that you already, like, you go to the room and here a resident and female and male are sitting together or hugging, okay? Or just like holding each other's hand. You're going to stop them? You will not stop them. Sometimes, I'm talking about also, again, from my own experience, sometimes the families will be with us, and then they will see that their mom is talking to them and say, this is my boyfriend. She will introduce the person as her boyfriend to them. And then they will just look at her and they will laugh and smile. They will say, as far as mom is happy, we're happy. You're talking here about the little touch that they made their mom happy, made their dad happy. Their dad was not happy. He was lonely at home. And the mom was lonely at home. She was always crying. She was always depressed. She was always sad. They didn't know what to do for her. And all of a sudden she found something to make her happy by looking at this man next to her, eating at the dining room, and all of a sudden they're holding hands. They're not doing any other than holding hands. What's wrong with that? I don't see anything wrong with that. I see that something gave them a sense of well-being. I think that gave them a sense of self-esteem that, I'm still here. I'm still able to touch and feel the touch that I've been touched with. I think this is awesome. That's how
I do too. Oh, I definitely. I used to think, if Matt had to be placed, and if if he was attracted to somebody in the facility, I don't think I would have mind, because he would have made him happy there, if he had to be placed. So, that's what we should want for our loved ones, is for them to be happy. And I think a lot of times older, the children, they're grown, they're adults, they have a problem with accepting that their parent is attracted to someone else. And it shouldn't bother them, but it does.
Some of them it does, and you have to do something about it by just like separating the couple and just have them in different rooms or different homes, or don't let them sit at the same time that they're sitting. But this is really not right. But what can you do? You know, it's a family consideration. You have to consider that. If the families are asking you to do it, you try to teach them and tell them, you know, there's nothing wrong happening. There's nothing wrong affecting them. All what they're doing is what you see there. But if that's what you want, we will try our best to avoid having them together, and that's it. I mean, this is what you need to do. Unless the family are accepting it, you cannot force it. And I know sometimes it might hurt the elderly. It might hurt the mom or the dad. It will hurt them big time. But later on, they will forget, you know, and thank God for dementia and forgetfulness. You know, they will forget, out of sight, out of mind. But I'd rather see the smile on their faces and the joy while they're holding hands than seeing someone depressed, and I need to give them an antidepressant to help them.
Yes. And this just shows, Maria, like I've been saying for a long time, touch is so important. Showing love is very important. You know, I have this saying, dementia robs the brain. It doesn't rob the heart of love. The heart still knows love. And I have always believed that, and I will continue to believe that. Matt knew Josh and I loved him. He knew that, and we knew that he loved us. And there's such a strong connection that goes beyond words that I can't describe. But that unconditional love is just a phenomenal, you know, and it's hard to put in words unless you've experienced it, but I know you understand what I'm talking about. People of all ages need to be loved. They want to be held. They want to have that human contact. And that's why during COVID-19, the pandemic, when they couldn't be touched, they couldn't be held, they progressed. They got depressed.
Suicidal rates was very high. Depression, suicidal, all of these sadness and side effects. I would say it's a side effect of the pandemic and being social distance from each other. Yep.
Yes.
So,
that, you know, affected.
You were asking me, like, what can we do, like it's two of them, or if one of the, you know, or the elderly approach you with any sexual something, you know, attraction or a touch, or as you said, a word, or we don't want to consider it as a harassment, but there are some interventions for those inappropriate behaviors, we call them, at the bedside. So what we can do for them in a facility or even at home, if you feel like, you know, you have to do some intervention for those inappropriate behaviors at the bedside, you can raise the bed rails if this person has bed rails, so they don't have to, you know, be out of bed, which is kind of a restraint there for them, and step back from the bed. Use a calm and firm tone voice. As I said before, you have to just talk to them in a calm, firm tone of voice, and call this resident by their surname, you know, to get their attention, to create a formal boundary between you and them. You have to identify yourself and your function with him. You know, I'm your nurse. I'm your caregiver. Yeah, let them know that you are not their, you know, companion. I'm talking about the companion as, you know, a spouse or a girlfriend or a boyfriend there. Do not use, do not call verbally, and do not ridiculous, and do not, you may need to excuse yourself from the room. You might just need to just say, I'm sorry, I can't stay in the room. I have to leave. And at sometimes we have to exchange or to just get another caregiver to work with this person. And that's it. And we did it. We did it several times that, this person is going after this caregiver. He wants to keep touching her, and inappropriate touch there. And the caregiver did not feel comfortable with that touch. So what we did, I just said, you know what, let's get you in another facility, and then we'll just get him another caregiver to work with him in this facility. And we were able to solve the problem. So that depends, again, teaching, education, training, and able to solve the problem on the spot. The caregiver was honest enough to come and say, I don't feel comfortable working around this man. It's fine. So we just, take her and put her in another facility that we have, or in another, taking care of another resident. So interventions for inappropriate behavior in public and the common area, this is another thing that we notice that, or we've seen them in our facility or in our long-term facilities. You have to remove this person from the scene. If this person is, let's say, for example, masturbating in the living room, you have to get this person in his room. Why do you have to keep them there? I know sometimes you'll be busy, you'll be working, and all of a sudden you notice that this person is doing this action, which is very inappropriate. So just say, come on, let's go to your room. You can, finish it there and take him to the room. Assist that person to his room and get him some privacy, pulling the curtains and just give them some privacy, and then provide the comfort items for them if necessary. This will maintain dignity, and it will not make them feel that they did something shameful. Because, once they're doing it, they're not aware of what they're doing. But when you point it out for them, they will immediately click to their head. So you just say, come on, let's go to your room. You take them to their room and provide the room for them and let them do whatever they want to do. Safely, comfortably, give them self-respect and give them the courtesy.
Yes, there shouldn't be any yelling or shaming the resident.
No.
At all. I worked in a state institution for the severely disabled, and they always were masturbating, and we just pulled the curtain and they did their thing, and it was just, that's what they did. Some of them would even go into seizures from doing it.
Exactly. And
but
it's also,
Oh, go ahead.
And also,
go ahead.
It's not like, it's important for them. Like, once this is a stress relief. We said it from the beginning. If we allow them to do it, we reduce the hassle on our caregivers. We reduce the hassle on ourselves as caregivers. We reduce the tension that they're going through by letting them just feel comfortable and do what they have to do in a safe environment and with the privacy. But the question is now that we raised it at the beginning, what if those are a couple, husband and wife, and there is dementia there in between? I will do the same. I will just go ahead, get those couple engaged in this relation, take them to their room, allow them to have privacy, keep the family informed. This is important. The family has to be informed, because you don't want the family to come and visit while their mom and dad are in the room and, having their intimacy time. So the family has to be informed, and they need to know the plan that you're having for their loved ones, for their dad and mom. They're husband and wife now with you, and they want to have their, relationship in the facility that they are with you under your care. And you need to observe those changes that happen with them between the two partners. Is it something that bringing a positive outcome, or is bringing more tension to them and stress? And then you treat based on what you found, because there is important thing to be observing there. It might be an abusive relationship. It might be just like a simple relationship. So this is an observation, you as a caretaker, caregiver, in the facility, watching those people, watching those couples that they have dementia, but they're having this relationship. Because, intimacy doesn't affect by the dementia. This is a need. It's like the way they can eat, they can have this relationship. This is the basic need for them. Yes,
it's very important. I had to say this cute story. It has to do with my mother-in-law. Matt's mom had dementia, and she was a little lady. and very tiny, and she was in a county nursing facility, and there was a man who bothered her, and she whacked him. She hit him. So
exactly.
the facility called Matt up and said that, and I said to Matt, your mom is in her 80s, and she's still got game. There's men are still after her. But she, didn't like it, and she whacked the guy, so he got hurt. So, I mean, the staff has to be observant. Is the other resident bothering the other ones? You don't want it to get to the point of a resident being aggressive toward another one. So I'm sure that, facilities have to watch out for that also.
Yes, exactly. Observation is important because you need to stop any abusive environment because it's not meant to be abusive. It's meant to be pleasant and conducive. It's meant to be for their benefit, not against their benefit. Right.
You don't want residents aggravating and being aggressive toward each other. What do you do in that case, Maria, if you have a man or a woman that's being aggressive to another one in a sexual way and they are fighting?
This is where we have to separate them immediately because you cannot do that. You cannot allow it. They, as I said, it has to be something pleasant, not harmful. And if that's going to be an abusive environment, you have to intervene. And this is why observation and continuous observation is very important. Teaching all the caretakers, caregivers, of what to look for, what to observe when this is happening is very important. They need to report to you as the manager that, this is what we noticed. There was crying, there was yelling, there was screaming, there was abuse. We don't want that. And we have also, sometimes we have to treat. We have to use medication to help this person to get less agitated.
Right. Sometimes medication has to be used. Yes,
it has to be used. And sometimes, the aggravation is when the elders are not able to reach their satisfying point there. So that's when you have to consider the use of lubricants. You can advise them to use lubricant. You can advise them to use some hormone replacement, as I said, some medication that might help. And that's why observation is important. You're not going to go in the room and observe what they're doing, but based on what feedback you can get from them, it becomes hard for them to achieve what they want. It's becoming if that's the man, you can ask him to use lubricant. You can ask him to reach to the OBGY and help with some hormonal replacement. You can also get them some medication like the Viagra, and we use it for some of the patients. The doctor ordered some Viagra for them I have a couple of years ago or more, I have a gentleman, an older guy, came just for a short time with me. And he was using Viagra, and that's just to help him be with his wife. And they both were, with me for a short time. And then it was satisfactory for them, and he was happy. So sometimes also you need to also, if nothing can work, you can encourage masturbation. Just say, you cannot make it, just go ahead and try to use this method. It might help you. Try to give them options too. And I know that it's hard for us because we're not yet open to intimacy and aging and to talk this open about sexuality. But I think we have to reach a point to prevent complications of aging and sexuality. You have to start teaching about it because we all are facing it. And instead of hiding it, we have to start being more open about it and talk about it. I mean, the doctors are willing to give Viagra. The doctors are willing to give hormone replacement. They even suggesting, what I'm talking about is in the book. I didn't bring it from my head. We're talking about something like they can use magazines, they can use videos, accessories to help them get aroused. And then they will be more satisfied with their relationship, with their husband and wife, with their partners, with whoever. But they're aged now, and they cannot act the way they were acting when they were younger. So now they need more help.
Right. And I think the younger generation needs to realize that, the people that are getting older now were the baby boomers, who were raised in a very, kind of a loose, liberal, sexual way.
Exactly.
Didn't have sex hang-ups. And then you could also go into, if you have a gay or lesbian couple, how does a group home handle that? And you can't stop them just because of their sexual orientation. So this is another area also.
This is another area where we'll start talking about it in the future. Yes, that's another subject about aging and sexuality when it comes to the homosexual. Yes. And
yes, and please come back for that.
Yeah. So let's see how the people will react to this one first. Then we'll go down. Yes. And actually, this is exactly what I'm thinking about. Honestly, that's what we were talking about yesterday. And we're going to be talking about in the future about the preventive of sexual diseases that happen, and that happen more in elderly people because they're not using the preventive measures. We'll talk about that one in another time. And to conclude my presentation or my talk for today, I just want to emphasize on the education and intervention for your clients on intimacy and aging. You have to do education or in-service training to the clients on safe sex. That's very important. You have to do education and in-service training to your clients as staff, to the families, on the topics of sexuality and intimacy in the elderly. They need to know about it. All of these people, I cannot stop emphasizing on the importance of teaching staff, caregivers, caretakers, nurses, even doctors. It is important to know about intimacy in aging. It's very important. And some residential long-term facilities make condoms and other products available in the gift shop, believe it or not. And I've seen that one on a video I was watching in Denmark, in Europe, that in their gift shop they have condoms so they can use it, they can buy it, and actually they encourage the elderly to use it because they want to prevent the sexual transmitted disease, because it's really very high rate in elderly, because they think that the use of condom is only to prevent pregnancy, and it's not. At that age, you're not going to get pregnant anyway, but you need to prevent yourself from getting any sexual transmitted disease, especially when you are having, or this person is having dementia, and he doesn't know that he's sleeping with this one and this one and this one, and he doesn't know who is having the disease, he or she.
Right.
And then we have to encourage the clients to discuss their sexual health with their physician. It is important to discuss it. If they cannot discuss it, they can discuss it with you as a caretaker, and you take this and discuss it with their physician, so the physician can come back to us and help us with whatever advice, medical advice we're talking, because we still have to go under the doctor orders if the doctor is going to order something for them. If they got urinary tract infection while they're, doing things together, they might get urinary tract infection. We have to get the physician to say, they've been in relationship, she might get UTI, we need help for that. We need to discuss this with the physician. The physician has to be aware of what's going on. Based on what we tell them, they will be able to prescribe the right medication for them, the right treatment, and the right advice for us.
Well, thank you, Maria, for coming on and educating us on sex and intimacy in residential setting with those with dementia. I know that I've read it, that even in retirement communities, there's a high rate of sexually transmitted disease because they're not using protection. And, you have to at all ages. So I want to thank you for coming on. Maria, can you please tell people how they can connect with you through social media?
We have the Facebook, of course, Facebook page, which is JK House of Grace Assisted Living Homes. We have we're on Instagram, JK House of Grace, Instagram, and we are also on LinkedIn, JK House of Grace or Maria Khader. I have the two names there. You're welcome to connect with me. You can also communicate with me on as an email. Send me an email at jkhog@jkhouseofgrace or office@jkhouseofgrace.com.
Thank you. Now, I have to ask this. That's great. Are you giving virtual tours or in-house tours now, still with the pandemic? Okay.
I'm very blessed to have people that they knew about us through our social media, but they don't live in the area, so I have to do virtual tour with them. I have people from other states like Florida, Colorado, North Carolina, California, New York. So I do that on as virtual. And then when they're able to come and visit, they will come and visit. But, I already have their loved one based on the virtual tour. But the local families, they will call and we will set a time and appointment for them to come and tour our facility. And we do have openings, and we're doing good.
Well, that's great. Well, that's because you are super fantastic, folks. I don't care if I sound like a broken record. You have to go on JK House of Grace Facebook page, and you have to see what Maria Khader is doing and her staff, and you'll know why I want to clone Maria and her staff and her group homes. It is such a role model. You set such a high standard, Maria. You set such a role model of how people should be treated in a group home, in a facility, when they're older. I admire you. You're so inspiring, and I thank you and your staff for what you're doing. It is National Caregivers Month, so thank you, Maria, and your staff, because it is Caregivers Month, but we should remember caregivers every day. Thank them.
Yes.
If your loved one is in a facility, a group home, or they're getting in-home care, thank your caregiver. Thank them. Give them something special. Throw them a gift card or something to let them know that you appreciate them. And it's also National Alzheimer's Month. We who lived it, we don't need to be reminded. It's you, the public, that need to educate yourself on this disease and other dementias. There's no cure. There's no treatment. There are clinical trials. Please educate yourself on this disease, because no one, and I mean no one, is immune to it. And we need to be educated. It's time to bring Alzheimer's and other dementias out of the dementia closet and out into the open, in the spotlight. You know how passionate I am about that, Maria.
That is true. And it's Veteran Day. So happy Veteran Day. We in memory of the veterans that
yes.
We don't know them all, but we owe them all. And it's Veterans Day 2021, and this is in memory of them and in honor of all what they did to our country and to our freedom. Most of the veterans that I take care of here, even the non-veteran, when we take care of them, I always tell our caregivers and tell myself that these people, they serve the country better than we are doing now, and we should always give them the best service. We should always give them the best care, even when they have dementia. It's true, they don't know what's going on, but we know who they are. We know what they did to our country. We know how they served our country, so we should give them the best care. I appreciate my caregivers, and I appreciate my residents and our families, because we all work together here to serve and give the best for our seniors.
Yes, that I know. folks, I'm telling you, got to go on there because Maria has parties. They cook. They have games. It's a home. It's a family, and it's amazing. I'll have to say it's amazing. Check it out yourself. Thank you for mentioning the veterans, Maria. Happy Veterans Day. Thank you to all the vets out there who served. And I think of my dad. He was in World War II in the Navy, and my father-in-law. And thank you all for serving. And those who are still serving, thank you. Because you know what? Freedom is not free. Somebody paid the price for us to be free here in America and in other places. So thank you. Folks, if you missed any of this podcast, you can hear it again on your favorite podcast outlet. I suggest you subscribe to Chatting with Betsy. It is for free. I'm on Spotify, CastBox, Spreaker, Amazon Music, to name just a few. And please share this podcast to help other people. Chatting with Betsy is not about me. It's about helping people, providing resources for people. So when you share this, you are helping somebody. We don't know who needs to hear this, but we need to get it out there to help people. Tell them about JK House of Grace. Tell them about sex and intimacy, about dealing with it with dementia or an elderly person. These are things that have to be talked about. And on Chatting with Betsy, people will speak their truth. I speak my truth. And that's what I do here. So thank you, Maria. Thank you so much. I want to thank Jeannie White for producing the show, writing the blog. The information about Maria will be in the blog, so please read the blog. It's very important. And I want to thank Lillian Caldwell, CEO, Passionate World Talk Radio Network, who gives people a chance to be heard. So thank you, Lillian, for making this all possible. And thank you all for listening. I appreciate it. Appreciate you listening and your support. And until we chat again, please be kind and remember, reach out to a caregiver, honor a caregiver, not just in the month of November, but every month, every day. Do something. Reach out with a text or something and say, how are you today? They would appreciate it. Thank you, everybody. This is Betsy Wurzel, your host of Chatting with Betsy on Passionate World Talk Radio Network. Bye-bye now.
Are you looking for an internet talk radio station for your podcast? Look no further. At the helm of Passionate World Talk Radio are two women that want to provide a spot for you and your podcast to be heard. There are many other places for your podcast, but PWTR has the audience. You will not be disappointed. Our station has been on the internet for the past 16 years. Call us for more information. 484-364-1032 or text Jeannie White, station manager at PHECONNECTSHOW@gmail.com for podcast show details. Thank you for listening to Passionate World Talk Radio. You can listen to this program all over again by going over to https://passionateworldtalkradio.com. You can also hear it on Spotify, Spreaker, Amazon ALEXA, AMFM247.com every Tuesday evening between 8 and 9 p.m. YouTube, Facebook, Facebook Live, LinkedIn, and all the other podcast directories one can find on the Internet.